training or workshops that we see our audience face to face, okay, and we can engage with them. But then again, because we cannot do it right now, it doesn't mean that we stop all this totally. Okay, so see, now we can still engage with one another through webinars, through YouTube, through Facebook. Well, it's a bit weird because I cannot see your faces or how you are responding to me. But at least I hope that you can see me and you are still receiving some form of sharing or information that I'm sharing with you. So we can still continue to do this. So you can still use this with your family members and friends, right? Okay, living space. This is something that I find very interesting, and it just pops up during this period of COVID. Assign space for different activities. There is a place for everything. Okay, when we say this is a living room is a place where we relax, we watch TV. When we say this is a dining place, this is a place where we have our meals. When we say this is our bedroom is a place where we sleep and rest our body and mind. There is a place for everything and assign space for their specific activities. And this helps to put in place healthy boundaries for your daily life. Why do I put in this point? I share with you, again, a patient of mine whom I do video counseling with him through Skype. So because of the Skype, I'm able to see his living space, okay? And he is very generous enough to, for the first 1 or 2 sessions, is very generous and is very excited to orientate me his bedroom, because that's the room where he sleeps, where he works, and where he does all his other activities. So in the room, imagine in your mind, I see his bed. On top of his bed, there's a work laptop. Beside the bed, there is a small table and a few of the unfinished meals. I think that was about lunchtime, so he has his meals there unfinished. Then okay, he is quite fortunate. His room is big enough, so there's a built-in toilet. So he showers inside the toilet in the bedroom. Just outside the toilet, there is a treadmill where he does his indoor exercise. So he will run on a treadmill in his bedroom. And then the other angle is his study table. That's where he will put his personal laptop. That's where he uses it to kind of like Skype with me. So in a way, I get to see his bedroom. And one day he told me, Miss Hui Ping, I don't know why, but I feel very trapped. Not just with COVID, but I feel so trapped in my own room. I don't know why it's happening. So I reflect to him, hey, I see that you sleep in this bedroom. You also work in the bedroom. You eat in your bedroom. You exercise in your bedroom. What do you think of your living space? Okay. So interestingly, he got my point. Yeah. So the next session, I see changes. He has moved the treadmill out to the living area. He has a balcony outside his living room. So he moved the treadmill out. He decided not to eat in his bedroom, so he will go to the dining area for his meals, etc. And that's where he feels that really that he doesn't feel that trapped anymore. So we have to put in place healthy boundaries. I think many of us are too comfortable that, okay, I will work in my study room. I will also have my whatever non-study or non-work related areas in my same living space. And that can create some kind of boundaries issues. That brings me to the next point. Okay, declutter your living space. Can you imagine that patient who I mentioned just now? Can you imagine how cluttered his bedroom is with so many things? Yeah. So declutter your living space. Okay, you also spend a lot of time tidying or cleaning your house, right? Use this time to throw away things that no longer serve their purpose. Because by having plenty of white space, it allows for calmness and peacefulness. Okay, and the clutter can actually cause a lot of stress and sometimes anxiety that we might not be aware about. Okay, so that's why declutter is very important. You remove those things that you no longer need, and by removing this physical clutter, it can actually help to clear your mental clutter. So decluttering is freeing in so many ways. Go and try it out. Okay, the last point is maintain routine and structure. Stick to the same start and stop times for your work day as you did pre-COVID. So if your working hours before COVID is say 9 to 6, do so even if you're working from home. Okay, the tendency is, since I'm working from home, I can do a little bit more. I can check my emails after dinner. I don't have to log off. I can later, as and when I go back to my work laptop, etc. It's very important to remain or maintain normalcy within the disruption, because one day we will all go back to office, and it will make our transition back to regular life easier by maintaining a routine. So as much as you maintain your routine, of course, our bosses have to respect our boundaries as well. So for bosses, for management here, I encourage you to really give your staff, your employees, the space. If it's after their working hours, then contact them maybe the next working day. Okay, unless it's very, very urgent. Okay, otherwise, really, we have to maintain the routine and structure. So that's the living space. Okay, so I mentioned about all these 5 areas: your body, your mind, your emotions, your loved one, your living space. You don't have to do all of them, really, okay? You can just mix and match. Today, you just do a few of this. Tomorrow, you do a few of that. And you just rotate them around or pick and choose whatever that works for you. The thing is, doing these activities repeatedly, consciously, continuously, it will bring in a new habit into your lifestyle. And this will help with your mental wellness. Okay. Now, taking care of your mental health isn't selfish. I always tell my patients, you have to first take care of yourself, because it is your self-responsibility. So like, again, many of us here really have to take care of ourselves first. It's very important. And especially during this COVID, understand that whatever that you're going through, okay, is common humanity. Everyone is affected, just that we are affected in different ways, in different degrees, at different levels, but we are all going through this together, okay? And know that you're not alone. It's okay to reach out, whether to reach out to your family members, to your friends, to your religion, so-called leaders or whatsoever, or a mental health professional. It's very important to really to reach out to someone if it gets too overwhelming. Okay, so these are the references that I use. I won't go through. And if you're interested to know about Parkway Cancer Center, our articles and what's going on in our organization, you can scan this QR code and subscribe to our e-newsletter. Yep, so that you can keep kept up to date. Sometimes we have mental health articles that the counselors will put in. We share about our dietitians, we share about nutrition, taking care of your body during this period. So really, there are a lot of information out there that you can really kind of like pick and choose for yourself. And I'm done. I will stop sharing my screen so that we can open up to the Q&A, right?
Awesome. Can we give a virtual clap for Miss Tan weeping? Okay. This is weeping is what you call a round of applause, right? Okay. And of course, those in the Zoom room as well. So thank you so much. I was also busily taking down notes. Personally, I like all the tips for all 5. The 5 circles, and I'm challenging myself and committing as well to kind of do, maybe at least one from each. Wow. Okay. I mean,
yeah,
go around, right? Because I think it also adds to the spice. It adds to the variety. Because I don't know about some of those who are listening and attending the session. It's like we don't even feel that it's a long weekend. Do you know that it's a long weekend here in the Philippines because it's a holiday tomorrow?
Oh, is
But
it?
it is, but it seems like any ordinary day. Okay, I kind of miss the energy, the vibration when you tell people long weekend. Everybody was like, and here now we go long weekend.
Yep.
So it's like because it's the same. We actually have 2 long weekends sweeping. There's tomorrow, There's tomorrow, August 21. It is like the death anniversary of Ninoy Aquino, one of our heroes. And August 31, which is a Monday, is also a holiday. It's our National Heroes Day.
So that's
right.
ends after the another. Yeah.
Okay. So the other one, the August 31, is it's every first month. Sorry, last Monday of in August.
Oh,
So
okay.
so there's a lot of this. So maybe my challenge to the PMAppers, come on, it's a weekend, long weekend. Why don't we try out some of the tips that we've been shared with us, right? So there's a lot. Now I need some help, okay, in terms of the questions. But may I throw the first question, perhaps, Weeping, okay? And because I what was a highlight for me was the Mentimeter exercise, that maybe only about two or three would really consult a mental health professional, right? A mental health practitioner. And yeah, I think in general that would be something that's why my question to you, right? Is this only in the Philippines, right? Or is it a trend that you see out in some of the other countries where you have talked? Because I feel like there could be a possible stigma when you when you visit, when you go to a psychologist or a counselor or a psychiatrist. So maybe I'm just curious, when do you think people should already start thinking of going to that route, okay, and not doing like self-medication or like what could be some signs? Would there be like signs that we should be aware of that, hey, you cannot do it anymore by yourself? I think it's time to seek some help, some professional help.
Right. Okay, I will first say that it is not just in Philippines, in fact. Even in Singapore, the stigma of seeking help from a mental health professional is there. So when people say that, when people know that, you go and see a counselor, or you go and see a psychiatrist, or you go and see a psychologist, they have all these very funny looks on their faces. So more hesitant to seek help from a mental health professional. I think it goes a long way, maybe with I'm not sure, the Asian context, because in the Caucasian, let's say in Australia, in the States, in New Zealand, for example, they are actually more open to it. Okay, I'm not sure whether it's our context, our culture in the Asian, we tend to be a little bit more reserved. So so instead of going to see a mental health professional, we are more keen to do it on our own. Yeah. So that's one. It's not just in Philippines. So I want to say it's not just in Philippines. And the thing is, okay, your question, like, how do we know that we have to go and seek help already? Sometimes I think for individuals, they might not be aware that they have been affected. Okay, which is very common because they have been kind of like trapped in that kind of like the mental health challenges already. They might not be able to see for themselves. So what's important is the people around them, okay? Close family members, friends, they are to tell, okay? Because friends, family members know us well enough. They know what is our usual self, what is our unusual self. So family members and friends will be able to pick up some of these telltale signs. Maybe it can be you get easily irritated, which is not the usual self, for example. Maybe losing of appetite, okay? Maybe not enjoying the things that he or she used to do before, which is very uncommon. So if family members or friends kind of like observe these patterns, okay, this is the red flags. I would say that they will have to probably kind of like tell the individual that, hey, shall we go and visit a mental health professional and talk about it? Okay, and just for a day or 2 days. Of course, if today I don't feel like eating, I don't have appetite, it's okay. Don't have to, because one time I don't have appetite, I'm going to go and see a professional. No, it's about a period of time. Say, give yourself 2 weeks. If for 2 the pattern has been very unusual, not the usual self, okay, then that's where visiting a mental health professional becomes relevant.
Awesome. Thank you. Thank you. You still have time, Weeping? I think we have just a couple of questions. Before going to the next question, I have an announcement. Our live streaming on YouTube, I think, got cut a bit. So don't worry, we will re-upload the video. Okay, because you know, Weeping, this is not just in the Zoom room, right? It's this being broadcasted as well on Facebook and on YouTube. Okay, I have a question here from Sister Maricor. If you can share some best practices, okay, some best practice in taking care of employees who are suffering from depression.
Okay, right.
Okay, because we are HR, right? So how do we kind of take care of our employees suffering from depression?
Okay, I think that's very important. First of all, I want to say that depression is a clinical diagnosis. Okay, so unless a person has been diagnosed by a psychiatrist to be on depression, okay, otherwise, generally we could see people are maybe feeling down, feeling
Yeah.
not to the extreme of depression, because they can be quite very different. Okay.
Yes. Got it.
Employees who are clinically depressed, then it's not just yourself. A lot more work has to be done. Medication, counseling, psychotherapy, for example. But if you're looking at in general, how to support your employees who are maybe feeling low, down, affected by COVID, for example, not to the extent of depression. I think as HR, you all will, I don't know, talk to them, right? Find out what are the challenges. Is it because at home they have to look after their kids? It's additional stress. So maybe it's to really to talk to them, find out what is it that they are stressful about. Is it because there's some crisis, personal crisis they are facing at home? So their issues, etc. Then see how best that the organization can support employees in coping with all this during this period.
Okay, thank you. Maybe last, I still have two more questions, Weeping. I have one. Can you share some practical tips to calm down an anxious mind and heart? Maybe instead of the depression, this time you have palpitations, so you're getting to have an anxious mind and heart.
Okay. I want to maybe hear something that is very simple for any of us to do, is to, when you find that your heart is beating fast, that is a sign of when you're getting anxious or overly excited of certain things, usually anxious. Slow down by doing deep breathing. Okay, yes, deep breathing. There are a number of so-called deep breathing exercises in Google, YouTube that you can try. Some of them say take 3 deep breaths, some say take 10 deep breaths or whatsoever. It doesn't matter. So the idea is really to do inhale and exhale, okay, deep breathing for a moment. It can be 3 minutes, a minute. That is helpful enough to kind of calm down, okay, any anxious mind or heart. So that's something that any of us can do at any point of time when we kind of, my heart is very fast. Okay, slow down. You might be able to put down whatever things that you are doing that triggers the anxiety. Okay, if that email from somebody is triggering you, getting anxious, email at that point of time, okay, do some deep breathing, go and get a drink, calm down first, okay, then go back to it. Okay, so something at the very straightforward, basic that we can all try it out.
Awesome. One more. Well, there's two more. Last two maybe after this, because we're keeping also our expert here. Is it okay? So we got a question. I believe this is, I don't know whether from Facebook or from YouTube. Is it okay for me to go to the office even if I am diagnosed with stress-induced anxiety disorder? Because I have been advised to rest for 7 days, but I think I did not take the 7 days leave. Yeah, so would it be okay to still go to the office?
Right. For this question, I actually have another. I have one question for this participants. I'm curious to know why you didn't take that 7 days of leave.
Yep. Yep.
Because now I don't know what exactly is the reason. Could it be because there is some urgent work issues, for example, that she or he couldn't take leave, or maybe there's
Right.
at home that she or he cannot rest and she or he prefers to come to the office. So
Yes.
without knowing why is it that he didn't take that 7 days, I'm not sure what exactly is the real issue here. But what I want to say is, if the doctor has given or has advised that you take that 7 days of leave, that is a reason why the doctor does that, right? So
Yeah.
it's always good to really listen to the doctor.
Yeah. I think doctors would know best, right? Because they have diagnosed this person. So there must also be a reason for the prescription.
And why is it not 3 days, not 5 days? Why is it 7 days?
Yeah.
There must be a
Agree.
reason
Yep.
why this is given. So
Okay.
I don't know why the person is not taking that day, those 7 days.
Okay.
But really is if you're experiencing and you're already seeing a doctor, but yes, you're not day, then you waste your money, right?
Yeah. Yeah. Or
You already see the doctor and the doctor has prescribed you and give you so-called what to do. So
yeah.
the instructions. Okay.
Or maybe weeping. I remember one time a doctor prescribed to me to go on a voice rest.
To go,
Like to rest my voice because I don't sing weeping, I do workshops. But you know what I did?
you need a lot, you need a lot.
Yeah, I need a lot of water, right? And all. But you know what I did with the doctor? I call that negotiation. Okay. I negotiated with the doctor, Doc, I cannot take 7 days. Can you change your prescription now to 5 days? Okay. So
You have become the doctor. So you're so close. You are the patient telling the doctor what to do.
I call that weeping influencing. Okay.
Right. But really, the point is there is a reason why the doctor prescribed.
Exactly, exactly.
So really,
Actually, I didn't. Actually, weeping, I didn't win. Yeah, he still said 7 days, so I have no choice.
right. So really, I encourage that these participants to really have a good rest, because by resting, you are actually allowing yourself to proceed further, to journey
Yep.
further, and that's
Okay. One final question. All right. Okay. There was a reply. Can we? Weeping, there's a reply. I
okay.
did not take the leave because my supervisor was also sick.
I
So I
see.
have to take her responsibilities. Yeah, so she cannot. Thank you. Wow, these are really our HR heroes, right? So that was the reason for it.
So the supervisor is very fortunate to have Wayne as the employee, because the supervisor get to rest. Okay, but
Yeah.
he didn't get to rest. So I don't know whether
Mm,
win-win situation somewhere whereby both of them who are sick get to rest, and then somebody to cover the duties for the period. If it's not, then maybe wait for them to return back to office and then do it.
yeah.
Voice it out to our HR, to our department. We can see how to kind of like manage some of these work issues, because
True. True.
most important, if you fell sick,
Mm,
say 7 days, you will be able to work for
yep.
7 days.
Yes.
Yeah.
Yes. Yes. Yep. Yep.
Yeah.
Okay. One final question, weeping. One final question. Um, can you share how your organization screens or what questions do you ask the callers in doing a mental health assessment to determine the extent of their condition?
Oh, okay. Okay, for us, because I'm a counselor, I'm not a psychologist. Okay, I don't do a lot of assessments, frankly speaking, and I don't kind of like screen my patients in a very scientific way, okay, because that's the rule. For me is when my doctor refer the case to us, the doctor will have his own screening already. So the doctor will screen first, and then that's when the doctor will refer to my
Yes.
we see the patients, and we take it as patients who come to us, there will be some form of need. Okay, so I didn't go into determining what is their condition. I just go straight to finding out what are their issues. Okay.
Yep.
From there.
Okay. All right. Okay. I guess we've extended actually, right? Because I think 1 hour is not enough for our daily dose, right, of mental health. So really, really, on behalf of the People Management Association of the Philippines, I hope this is not the last sweeping. Okay? We hope we can get to still invite you. So can we give another round of applause or virtual applause or whatever else? Thank you so much, Weeping. Thank you for your time. Thank you for the talent. Thank you for all the tips that you have given us.
Thank you so much.
Thank you so much. Thank you so much. So we did our research as well. I asked actually the PIMA professional staff. Thank you, Carol, and thank you to everyone. My fellow PMAppers, you know that